In the introduction, diabetes mellitus, commonly referred to as diabetes, it is a group of metabolic disorders over a prolonged period characterized by chronic hyperglycemia. Okay, so this diabetes mellitus, also known as referred to as commonly known as diabetes, it is a group of metabolic disorders, and in a prolonged period, that means for a long, it will occur for a long period of time by chronic hyperglycemia. That means as blood glucose levels will be rise with disturbances of carbohydrate, fat, and protein metabolism, resulting from the defects of insulin secretion or insulin action or both. It may be either due to the insulin defect in the secretion of insulin, then it may be due to the action of insulin or both. In the definition, diabetes mellitus, it is a group of diseases characterized by high levels of blood glucose resulting from the defects in insulin production, insulin action, or both. It is a multi-system disease related to the abnormal insulin production, impaired insulin utilization, or both. So it is also a multi-system disease which is related to the abnormal insulin production. It may be either related to the insulin production or the impaired insulin utilization. The body may not be able to utilize the produced insulin, or it may not be able to do both. So the causes includes like hereditary. It may be hereditary obesity due to old age, due to renal diseases, due to viral infections, other systemic diseases, insulin imbalance, then PCOS, then hypertension. So this may be the causes of the diabetes mellitus. Then the types, it is of two types mainly, but there's also one type of diabetes, that is a gestational diabetes, which occurs during the pregnancy. Okay, the first type is the type 1 diabetes mellitus. It develops when the body's immune system destroys the pancreatic beta cells. Okay, the beta cells which are produced in the pancreas, it is the cells which is involved in making the hormone insulin. Okay, so when these beta cells are destroyed, the pancreas are not able to secrete that insulin hormone. Then this insulin, which is capable of regulating the blood glucose level, they will not be able to do so. So this is also known as the insulin dependent diabetes mellitus, or the juvenile onset diabetes. Then type 2 diabetes mellitus, which is the most common one, it usually begins as insulin resistance, a disorder in which the cells do not use the insulin properly. The insulin is produced inside our body, but our body is not able to utilize that insulin. So as the need for the insulin rises, the pancreas loses its ability to produce the insulin. When the insulin is not able to utilize properly, then the need for the insulin in our body will rise, and then after that, what will happen? The pancreas will gradually lose its ability to produce the insulin. So this is previously called the non-insulin dependent diabetes mellitus, or the adult onset diabetes mellitus. The first type one, that is the insulin dependent, or the early onset, or the juvenile onset. It may occur in the childhood. Then in this type 2 diabetes mellitus, it will occur after the adult only, also known as the adult onset diabetes or non-insulin dependent diabetes mellitus. Then next is the gestational diabetes. It is a form of glucose intolerance that is diagnosed in some women during pregnancy. Okay, this occurs mostly during the pregnancy due to the glucose intolerance in some women. It is more common in obese women and women with a family history of diabetes. In this case, the diabetes will be there only during the gestational period, not before or after that. So we can see also in the picture, type 1 diabetes, glycogen and protein breakdown will be there. Then it will be and then the muscle will be unable to use the glucose due to the low insulin. Then when the increased glucose is there due to the low insulin, muscle will not be able to use the glucose. Then glycogen and protein breakdown will be the cause. Then in the type 2 diabetes, what will happen? There will be increased glucose in the bloodstream, but the muscle will not be able to utilize the produced insulin. So this may be due to the factors like obesity, then hereditary hypertension and all. Okay. Then in the pathophysiology, what will happen? The destruction or the inflammation of beta cell of Langerhans of the pancreas. There will be destruction of the beta cells in the pancreas that will decrease the secretion of insulin. Then insulin requirement is not sufficient for our body. Then if the insulin secretion is not sufficient, then obstruction or disturbance in the carbohydrate metabolism will be there. Then there will be increased blood sugar level or hyperglycemia, which is caused by the which may cause the decreased glucose level and decreased energy. Patient may feel fatigue. Weight loss will be there due to the improper carbohydrate metabolism and also increased appetite. Then clinical manifestation include polyuria, that means frequent urination. Then polydipsia, excessive thirst will be there. Polyphagia, excessive hunger or increased appetite will be there. Then involuntary weight loss. Then blood basin, smell of acetone. Then lethargy. Then changes in the LOC. Then altered immune and inflammatory response, recurrent infection, prolonged wound healing, then genital pruritus or candidal infection may also be present. And in the diagnostic evaluation, we can first we'll do the history and physical examination, then fasting blood glucose we will take, then random blood sugar test we can do. We can also do the HbA1c test, that means the glycated hemoglobin A1c test. This test does not require any fasting. It indicates average blood sugar level for the past 2 to 3 months. So it will indicate the blood sugar level for that patient for the past 2 to 3 months. So it will measure the percentage of blood sugar attached to the hemoglobin, the oxygen carrying protein in the blood cells. So it is known as a glycated hemoglobin test. The higher your blood sugar levels will be, the more hemoglobin sugar will be attached. Okay. So if the person's hemoglobin is attached with glucose for the past 2 to 3 months, then the person it indicates that the person has diabetes. The HbA1c level of 6.5% or higher on 2 separate tests indicates diabetes. On A1c test between 5.7 to 6.4% indicates pre-diabetes, and below 5.7 is considered normal. Then next is the oral glucose tolerance test. For this test, overnight fasting is needed and the fasting blood sugar is measured. Then what will happen after overnight fasting is done? Then drink a sugary liquid is allowed to drink. Then blood sugar levels are tested periodically for the next 2 hours. A blood sugar which is less than 140 milligram per deciliter, that is 7.8 millimole per liter, is found to be normal. Then a reading of more than 200 after 2 hours indicates diabetes. Then a reading between 140 to 199 indicates a pre-diabetes. Then other blood tests like lipid profile, blood urea nitrogen, serum creatinine, islet cell autoantibodies, this also might be done. Then fundus examination, neurological examination including the monofilament test for sensation of the lower extremities. In the fundus examination, what we'll do, the fundus of the eye will be examined with the help of the ophthalmoscopy. Then we will see whether the retina, whether there is any changes in the retina or not, whether there is any hemorrhage, microaneurysms are there in the eye. Then this monofilament test, it is used to test the sensation in the lower extremities. As you can see in the picture, the small monofilament is used to prick or to give the stimulus to the food in the given areas, and then if the patient can feel the sensation or not. ankle brachial test, that means ABI. The ankle brachial index test is a quick, non-invasive way to check for the peripheral artery disease. Okay, this is used to check for any peripheral artery disease. The disease occurs when the narrowed arteries reduce the blood flow to your limbs. Peripheral artery disease can cause leg pain while walking and increases the risk of heart attack and stroke. Then this ankle brachial test, the blood pressure which is taken at the foot and the blood pressure which is taken at the arm is compared, and then an ankle brachial index is ratio is found out to test whether the ratio is less than 0.9 or not. If the ratio is less than 0.9, then that person will be at risk of having the peripheral artery disease. Then urine ketone test. High ketone level will indicate the diabetic ketoacidosis, so it will be done by doing the dipstick urine analysis. Then management of diabetes. The first treatment is insulin therapy. Both oral and injection can be done. So there are 4 types of insulin. The first one is the rapid acting, short acting, intermediate acting, then long acting. Then rapid acting, it will be effective. It will be its brand name is Humalog, Novolog, Epidra. Its onset will be 10 to 30 minutes. Peak will be there when 30 minutes. When it is at 30 minutes to 3 hours, then it will work for around 3 to 5 hours long. Then in the short acting, this is the regular type. Then it will be onset will be from 10 to 30 minutes, and peak value is 2 to 5 hours. Then intermediate onset will be 1 to 5 to 4 hours, then peak value is 4 to 12 hours. And long acting like lentils, which is given during the night time, this is onset is 0.8 to 4 hours, and minimal peak will be there, then duration will be up to 24 hours. Then oral insulin, which is the most common one is a metformin, that is glucophage, glumetza and others. Then glipizide, metformin and glipizide, that is a second generation sulfonylureas. Then transplantation can be done, then pancreas transplantation, then bariatric surgery. Although it is not specifically considered a treatment of type 2 diabetes, people with type 2 diabetes who are obese and have a body mass index higher than 35 may benefit from this type of surgery. Next is dietary management. The foods to be avoided by diabetic patients are potato, jam, sweet patties, mango, banana, alcoholic beverages, fried foods like paranthas, deep fried cakes, then cakes, pastries should be avoided. Then the foods which are to be used daily are green leafy vegetables, tomato, cucumber, black coffee or tea without sugar. Then about half energy should be get from the carbohydrates, and 1/3 energy from the fats, and 15 to 20% from the proteins. Meals should be taken at regular time. If the meal will be late, then it may cause the hypoglycemic attack. And nursing management, you just review. Then the complications are, you all know, the diabetic retinopathy, diabetic nephropathy, then diabetic neuropathy, stroke, then cardiovascular diseases. And foot damage may also be there. Nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications. If left untreated, cuts and blisters, they can develop into serious infections which may often heal poorly. Then Alzheimer's disease. Type 2 diabetes may increase the risk of dementia such as Alzheimer's, then diabetic ketoacidosis, then hyperglycemic, hyperosmolar, non-ketotic syndrome may also be the complications.